Good evening. I'm Adrian Arsenault.
And I'm Andrew Chang. Tonight, the first AstraZeneca vaccine doses are almost here.
It has been shown to be effective for people under 65.
But hear why some provinces are saying not for our seniors.
Also tonight, the dread of aging out of foster care.
How to cook, how to go to school, like how to pay my rent.
Ontario says it is time to change the system.
Why some Dr. Seuss books are getting the hook.
I would think of it more in terms of a product recall. We have realized that there are things in these books which are damaging to the consumer.
And along with our own new investigation into long-term care homes, we talk with author André Picard.
We have to decide that elders matter.
The urgent crisis and the way out of it. This is The National.
Well, as of tomorrow, 3 different COVID-19 vaccines will be available in Canada. Hundreds of thousands of doses of the AstraZeneca vaccine are arriving over the coming weeks, and eventually there will be millions. And for provinces trying to ramp up, more options, more doses are vital.
But with choice has come some confusion. So tonight, we'll look at the vaccine and how it may be used in Canada. Health Canada approved it as safe and effective, but just days later, NACI, the body that advises provinces on vaccines, said AstraZeneca isn't recommended for seniors. Several provinces are now signaling they will follow that advice.
So David Cochrane explains what that recommendation means now for all those Canadians waiting to roll up their sleeves.
The first doses of the AstraZeneca vaccine will arrive on Wednesday from India, bringing a new supply and new questions.
The conflicting advice between Health Canada and experts on the immunization task force is concerning.
There's no disagreement that it's a safe choice, just whether it's the best choice for people 65 and up. Health Canada approved the vaccine for everyone over 18. But because of limited data on how effective it is for older people, the National Advisory Committee on Immunization currently recommends it only for people under 65, which is how several provinces plan to go.
It has been shown to be effective for people under 65.
The potential uses could be in younger, otherwise healthy people.
Which means a shift from the urgent focus on largely vaccinating older, more vulnerable Canadians, who will continue to primarily get Pfizer and Moderna.
I think we're going to use all doses available for Quebec in the right situation for the right person.
And who that right person is for AstraZeneca could change. There's growing data the vaccine is effective for people 65 and older. The United Kingdom is using it widely. France has approved it for people up to 75, which means the advisory committee could update its guidance.
Don't read their recommendations as sort of static. They will update as needed.
By the time that happens, it may not even matter for older Canadians.
By the time AstraZeneca and supplies pick up, we hopefully will already have done everyone 65 and older anyways with Pfizer and Moderna.
Okay, so David, provinces have this guidance now on the AstraZeneca vaccine, but they're also trying to decide how long they can delay second doses, right, for Pfizer and Moderna vaccines. So is NACI saying anything on that?
Yeah, this is something Quebec really started doing earlier this year. British Columbia is now pushing that dosing interval out to as much as 4 months. And other provinces, Andrew, also moving in this direction. And the National Advisory Committee, it may deliver new guidance on this as soon as tomorrow, but certainly it's expected at some point this week. And if it backs what the provinces want to do, that could really stretch the reach of the vaccine supply for at least that critical first dose. And Saskatchewan Premier Scott Moe said today that this would be a game changer and everyone could have at least one shot by the end of June.
David Cochrane, thank you.
You're welcome.
Let's turn to Canada's long-term care situation and the devastation the pandemic has inflicted on residents. Of 22,000 deaths, 70% have come in long-term care or retirement homes. Tonight, we look at what's been done to reduce the risk and stop the spread. CBC News has found that in Ontario, dozens of homes continue to break the infection prevention rules. David Common has this exclusive look.
When inspectors arrived at this Crescent Care home in January, their report makes clear 40 out of 45 residents were already infected with COVID. And yet, the same staff were still treating both positive and negative residents, violating provincial rules. Also, staff not being aware which type of PPE was to be worn, and finding hand sanitizer was not available where needed, all in violation of provincial rules. Many residents died, including Edwin Rutherford.
I couldn't be there with him. I couldn't say goodbye.
His granddaughter, Alicia Houchin, herself a staff member in another senior's home, says failing to follow infection control measures may explain the explosive transmission.
Yeah. They had plenty of time to prepare and to do whatever they needed to do, and they obviously didn't do it.
CBC's analysis shows between June and January, 1 in 12 Ontario homes have broken COVID directives intended to prevent virus spread. Nearly 4 in 5 of the violators are owned or run by for-profit companies. Crescent Care is one of them, though national chain Extendicare has the highest rate of such rule breaking.
These operators need to be held to account.
And yet, says this geriatrician, there are virtually never any consequences when owners and managers get caught.
How do we get all homes, not just the for-profit ones, to meet the standards of care and have serious penalties and repercussions for failing to do so?
Extendicare, one of Canada's largest operators, says inspectors have only found COVID breaches in a small minority of the visits, but that their goal is to have no issues. Crescent Care Homes had no comment. For those grieving, like Alicia, there's also bewilderment. How can the safety rules specific for COVID still be broken this far into the pandemic?
So, David, what difference does it make for infection control that most residents of long-term care homes in Canada have now had at least one dose of the vaccine?
No question that vaccine is now saving lives. It's why we're seeing deaths and outbreaks subsiding in long-term care in Ontario. But it doesn't mean that infection prevention and control isn't critical in the post-COVID world as well, because of things like the flu, which do kill in Ontario care homes and throughout the country. And so it is critical to get that right. And if you aren't getting it right, a lot of questions about what kind of enforcement there is to catch those who get it wrong.
All right, David Common, thank you. The devastation in many care homes in this pandemic, all those deaths, have really highlighted the problems with how society looks after for those who for so long looked after everyone else.
That's what paying our taxes is. It's insurance for being taken care of later. And I think we've broken that social contract, and we've done it in a horrible way. And that's
in just a bit, my conversation with columnist and author André Picard about his new book, Neglected No More, and how he wants to see elder care change.
Now here's official confirmation of what you already might have guessed. 2020 was the worst year for Canada's economy in more than half a century. GDP contracted by 5.4% overall. The damage was mostly done last March and April when lockdowns put a stranglehold on businesses. But growth did return in the summer, and 2020 closed out with 2.3% growth in the last quarter. Some economists point to a big rebound in the resource sector and a raging housing market that never really seemed to get caught out by COVID-19.
For the small businesses hit so hard, Ottawa has been offering help. But as Catherine Cullen tells us, one of the programs has left many entrepreneurs confused about the application process and unable to get all the money they need.
So welcome to the Forest of Bras. As you can probably tell, we carry a size range.
Angela O'Brien has been doing everything she can to keep her business going. In May, she made this video.
We have incredible cleanliness standards.
And when she learned the government was backing more interest-free loans, she leapt at the opportunity. But 3 months after applying, she's still waiting.
I was told to wait till the end of January, then wait till the end of February. Everybody was pointing fingers at everybody else. Nobody seemed to have any information.
The offer of help stretches back to October.
We are expanding the Canada Emergency Business Account, or CEBA.
Another $20,000 in interest-free government-backed bank loans for small businesses, on top of the $40,000 offered earlier in the year.
It is for businesses that, through no fault of their own, cannot operate at full capacity.
It took 2 months more to open up applications, and now, 3 months after that, many are still waiting on the money.
Probably somewhere in the vicinity of 60,000 to 80,000 businesses that are affected.
Some 470,000 have gotten the expansion loan, but officials won't say how many are still waiting.
There's a real desperate need for this money.
There's also the somewhat murky issue of what the actual problem is. But according to Export Development Canada, which administers CEBA, we are working diligently to finalize the new process so these applicants can attempt to remedy their application as quickly as possible. Hopefully in weeks, not months, an official said. O'Brien says she can wait a bit longer.
We're reasonably confident we can muscle through, and that, yeah, I'm going to pay a lot of extra interest on other debt, but I feel we'll be okay.
But she says she worries about other businesses that won't make it. Catherine Cullen, CBC News, Ottawa.
Now, Canada's housing market, as we mentioned, seems largely immune to COVID-19. If anything, the lockdowns may have redirected spending in affluent households towards housing itself. Briar Stewart takes a closer look.
Not long after Melissa McKayeff and Jim Wagner found out they were expecting twins, they started looking for a bigger place.
His work moved remote, I worked from home, and we were like, there's no way we are going to survive in a 2-bedroom condo with twins in Vancouver.
In the summer, they bought a home in Maple Ridge, a city 45 kilometers east of Vancouver. It's one of several communities where there's been a double-digit increase in housing prices.
It's not uncommon to see 20, 25, 30 offers on homes right now. And then those offers can go literally hundreds of thousands of dollars over asking.
All across the Lower Mainland, home sales are surging. New numbers from the Greater Vancouver Real Estate Board show that in February, sales were up 73% compared to the same month last year. Other Canadian cities are seeing what many didn't expect. Sales are also particularly strong for the more expensive homes in Toronto, Ottawa, and Montreal. Experts say key drivers are low interest rates and historic levels of household saving.
Those who had stable jobs, they were able to save more during the pandemic than they would have otherwise, traveling and eating out. And part of that is also filtering through back into the housing market.
The Canada Mortgage and Housing Corporation says while the market is strong, it is concerned about major risks. Employment conditions remain below pre-COVID levels, and the high level of support of government income measures are temporary. A big unknown, how long does this all last?
There will be a pullback at some point. It's hard to predict when, but you know that kind of price appreciation is not healthy in the long run.
But for now, with so much competition among buyers, Wagner and McKayeff are glad to be settled into their new home and focused on family. Briar Stewart, CBC News, Maple Ridge.
In the United States, President Biden says his government has dramatically accelerated his country's vaccination campaign.
We're now on track to have enough vaccine supply for every adult in America by the end of May.
So that is 2 months earlier than the administration previously anticipated. Biden is also directing all states to prioritize teachers and school staff in their vaccine rollout, aiming to get every one of them at least one dose by the end of March. Now, despite warnings from health experts, Texas moved to lift its mask mandate today. Republican Governor Greg Abbott says he will also do away with limits on the number of diners that businesses can serve indoors. The new rules take effect March the 10th.
U.S. senators peppered the head of the FBI today with hard questions about how it was that rioters could ransack the Capitol in a bid to overturn the last election. As Katie Simpson explains, his message was stark. It was terrorism, and the threat is far from over.
Pull them this way! The deadly attack on the Capitol was an act of domestic terrorism, according to the head of the FBI, who delivered a blunt warning to lawmakers today.
January 6th was not an isolated event. The problem of domestic terrorism has been metastasizing across the country for a long time now, and it's not going away anytime soon.
Under questioning by senators about how his agency failed to thwart the attack, Christopher Wray said the FBI warned about the possibility of election-related violence.
Why didn't you sound the alarm in some more visible and ringing way?
Over the course of 2020, we repeatedly put out intelligence products on this very issue.
Wray confirmed white supremacists and militia members are among the 300 people arrested so far. It's part of a much larger problem, he says. Domestic terror investigations have doubled since he became FBI director in 2017.
Racially motivated violent extremism, specifically of the sort that advocates for the superiority of the white race, is a persistent, evolving threat.
Some Republicans advocated for similar alarm about anti-racism activists involved in last summer's violent demonstrations.
We're not serious about tackling domestic extremism if we only focus on white supremacy.
Trump allies have tried to link far-left activists to the Capitol attack in a conspiracy theory that Ray debunked.
Based on your investigation so far, do you have any evidence that the Capitol attack was organized by, quote, fake Trump protesters?
We have not seen evidence of that at this stage, certainly.
Security here remains a real concern. Police are taking additional precautions as conspiracy theorists who support the former president may hold a rally this week. Katie Simpson, CBC News, Washington.
Well, in California, at least 13 people have died following what authorities are calling a devastating crash between an SUV and a tractor trailer.
Some of the victims were ejected from the vehicle. There's some walking wounded that pulled themselves out of the vehicles. And then once the allied agencies and our CHP personnel arrived on scene, they were also pulling people from the vehicle as well. So it was a pretty chaotic scene.
You can see the SUV almost wrapped around the front of the truck. Police say the car was carrying 25 people, ranging in age from 15 to 53. The cause of the crash still under investigation.
The 279 Nigerian schoolgirls kidnapped at gunpoint last week have been released, some of them injured. As Renee Filipponi tells us, the government is under increasing pressure to stop these kinds of mass abductions.
Smiles were mixed with tears of joy during an emotional reunion in Nigeria's Zamfara state.
I'm happy.
Other parents thank God for their return. The girls described a harrowing experience that left some injured and in need of medical attention. While we were trekking, they hit us with guns and beat us with a cane, says 15-year-old Farida Lawali. Others say the kidnappers threatened to shoot them. Authorities say ransom was not paid, though experts say it's common practice in this part of Nigeria. The state governor says they were able to secure their release through negotiations. This is the boarding school where the 279 students were taken at gunpoint Friday. Many schools in the country lack security, which make them an easy target, and children a very valuable one.
It's all about opportunity. Can you just walk in and have the opportunity to kidnap 300, 400, 600, 700 children? I think it's really just about the willingness of criminal structures to dare to do this right now.
The 2014 kidnapping of hundreds of girls from the Nigerian town of Chibok captured the world's attention. Terrorist group Boko Haram took credit for it, and also for a kidnapping this past December. But in this most recent case, and another at a boys' school days before, there is no affiliation with any terrorist organization.
A lot of kidnappings happening every day.
This Nigerian security analyst says paying ransom encourages kidnappers, not only in schools.
People are scared, people are worried, and we're looking up to the government to step in. But at the moment, we're not really seeing that much traction or that much movement from the government.
But the government vows it will protect these girls and others, saying it will go after kidnappers and end these heartbreaking incidents. Renee Filipponi, CBC News, London.
Well, CBC News has learned Ontario is overhauling how foster kids leave the system.
They didn't do anything to prepare us for reality.
Next on The National, the push to make sure teens don't simply age out of care.
Why some of Dr. Seuss's children's classics will no longer be published.
There are going to be those who cry cancel culture. I wouldn't frame it in those terms. I would think of it more in terms of a product recall.
Vaccine, 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 vaccine.
And with a few jokes, a few jabs.
Don't be such a chicken squat. Get out there and get shot.
Dolly gets a dose of her own medicine. We're back in 2.
Welcome back. More than 60,000 Canadian children and youth live in government care, and for most, turning 18 means fending for themselves. But CBC News has learned Ontario is looking for a better way of helping them gain a foothold. Angelina King shows us what they face.
Hey, Shamari. 5 years after aging out of foster care at 18, Shamari Mbeki still relies on support from a Toronto charity that helps young people through that transition.
You don't really get all the skills that growing up with an actual family and being interacting with your family, your loving family would give you.
Now the Ontario government has extended its moratorium on youth aging out of care. It began a year ago. It's now to last until September 2022. CBC News has learned the province will use that time to design the new system, doing away with the current age cutoff and working to ensure youth feel ready to be on their own.
We're building a model that is going to support young people through the milestones in their age.
Just under 12,000 young people are in Ontario's child welfare system. Some are eligible for financial assistance until age 21 and other supports until 24. But still, about half of young people who experience homelessness in the province were involved in that system. More than half drop out of high school, even more rely on social assistance.
This is fundamentally about bettering the lives of the most vulnerable young people in the province.
Cheyenne Ratnam was formerly in care and is working with the ministry to help develop the new model. She wants to ensure youth are supported to make their own decisions so people like Abdoulaye Diakabi can feel confident on their own. He was petrified to turn 18.
I was thinking how I'm gonna able to do my grocery, how to cook, how to go to school, and how to pay my rent.
Heather O'Keefe runs the charity that helps Mbeki and Diakabi.
They need to have people that care about them and guide them through life choices. They deserve what other young people deserve.
Advocates hope the new system here will serve as a blueprint for the rest of the country. Angelina King, CBC News, Toronto.
Well, next, a warning from inside a COVID hotspot.
If that was in a hospital or even in any other healthcare setting, alarm bells will be going off.
Why are our workplaces still so vulnerable to the virus? Plus,
vaccine, 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 vaccine.
The moment Dolly gets her shot and her message to the doubters.
Well, Canada's overall COVID-19 numbers are creeping up again. And the worry is that part of what's making the problem worse are the so-called variants of concern. At least 3 main ones being tracked in Canada, potentially more contagious, possibly more resistant to vaccination. As of yesterday, there have been 1,359 recorded variant cases in this country. That's 100 more than the day before, with the highest counts coming from Ontario and Alberta. Now, the Peel region is just one area reporting a rise in variant cases, and health experts worry that vulnerable workers are now at even greater danger, particularly those working in industrial settings. Christine Birak looks at why outbreaks keep happening in an all too familiar way.
Despite all the sacrifices Canadians have made during this pandemic, experts say some hard lessons have not yet been learned.
It is frustrating because we keep doing the same things over and over again, and the holes in the system have been identified a long time ago, and they're still the same holes.
Ontario's Peel region is no longer making headlines for rising caseloads, but variant cases are popping up. They're being met with aggressive testing, but experts say Peel revealed a big hole that several provinces still haven't sealed.
We have one of the largest manufacturing and distributing and processing sectors in all of Canada.
To date, Peel's had over 300 workplace outbreaks of the virus, nearly 40% of them in manufacturing and industrial plants.
These places have stayed open throughout the shutdown, and they became essentially hotbeds for infection.
I've previously worked in factories myself.
Dr. Amanpreet Brar knows firsthand how powerless minimum wage workers can feel. She's receiving messages saying, "I keep getting sent to different warehouses on temporary basis. Most of it is packaging luxury clothes."
If the workers are having mild symptoms or they've been exposed, they don't feel they are safe to take a day off.
Inspections of nearly 60 warehouses in Peel found compliance with public health measures was just over 64%.
It's quite low. If that was in a hospital or even in any other healthcare setting, alarm bells will be going off.
Anik Singh is a nurse at this isolation hotel. Peel pushed for this space to protect sick workers' families from also becoming infected, but more is needed.
In a nutshell, what we need is better sick pay benefits for employees and a better housing capacity.
Without them, many argue the virus and its variants will continue to spread. Christine Burak, CBC News, Toronto.
Okay, now I want to bring in Carolyn Collane, an epidemiologist and mathematician who's been doing COVID modeling out of Simon Fraser University in BC. And so, in some way, I got to ask the question, have we underestimated the spread potential of this virus in different populations, do you think?
So I think it's not so much that we miscalculated. I think it's that what we've learned about vaccines now, that they can block transmission effectively, really opens our eyes to the possibility of blocking transmission with vaccines as well as preventing severe outcomes with them.
Right, because there was a reason at the outset, right, for the focus on much older people in long-term care. You want to vaccinate those who are most at risk of severe outcomes.
Absolutely. And long-term care, we were not able to protect those individuals before vaccination. Hopefully with vaccination we will, and it's incredibly important to have prioritized them. Now, after we vaccinate the most vulnerable, I think we can open the door to thinking about not just preventing severe outcomes, but preventing whole chains of transmission. And by preventing a whole chain of transmission, you could prevent 20 or 30 cases and actually protect more elderly people by vaccinating those high contact workers than you might be able to just by vaccinating one at a time among the people at risk of the outcomes, because you can prevent those exposures.
Right, so here's the most difficult question. What is the point at which you do start focusing more on younger people who are transmitting the virus versus older people who are more susceptible to it? Because, the various provinces are lowering the age thresholds as they go, right?
That's right. I think for our modeling, we found after the 80 plus were vaccinated, along with certain healthcare workers and vulnerable groups, that's really the time when prioritizing essential workers. And by that, we mean people who cannot distance at work, whose work requires them to have contact. That becomes very, very effective, and we get a huge benefit from doing that.
When you say huge benefit, what is the difference in outcome that we're actually talking about here?
So that depends. It depends how long we want to have our distancing measures in place for, whether we reopen. If we want to keep our distancing measures going until September and keep COVID in control that way, then it kind of matters less. But if we want to reopen to the point where, we have an underlying contact rate that allows us to have more activities, then we could save 100,000 cases, for example, or hundreds of deaths. By vaccinating people to prevent people from being exposed in the first place. So in addition to protecting those individuals, you protect the communities around them. Kind of like when you vaccinate a GP, it's not because your GP is going to have a severe outcome if they get infected. It's because they're at risk of exposure and because they serve a vulnerable population.
And very
it's kind of like that.
Right, and very quickly, we have about 20 seconds left. The fact that we know we have variants in play, those push your thinking in which direction?
So I think they just mean it's even more important to get our population resilient to transmission as soon as possible. So get those vaccines rolled out more widely, and particularly to people who are at risk of transmitting those variants to others around them as soon as we can.
Carolyn Collane, fascinating discussion. Thank you.
Thank you.
Over the past year, more than 22,000 Canadians have lost their lives to COVID-19. We've been bringing you some of the stories of some of those who died, as told by their loved ones. Tonight, we have the story of Anna Elofer, who is remembered by her daughter.
My name is Chantal Bramy. My mother's name was Anna Elofer. She died of COVID on November 16th. She was an extraordinary person. Anna was born on December 29th, 1929. In Casablanca, Morocco. She was the second to last of 12 children. She married my dad against her family's wishes, and they immigrated to Israel in 1948. December 1959, we arrived on a boat in Quebec City and then Montreal. She worked in a salon when she came to Canada, and subsequently, 30 years later, bought the salon from the owner. And her phone was constantly ringing with clients who had become her friends. She was just a source of support for so many people all the time. She always saw the beautiful side of life. When faced with choices, she was always motivated by love and goodness. My brother, they were so close. The grandchildren, they adored her. She took our daughters to Mexico twice when they were in their mid-teens, and they wanted to go clubbing. And so they were telling me that she would go with them because she wouldn't let them go anywhere without her. She did all sorts of things with her grandkids that only she and they knew, Also, she loved adventure. That sense of adventure is certainly in the family, thanks to her.
We have many more tributes to those who died of COVID-19 on our interactive website. You can find them at cbc.ca/remembered. Now, with the pandemic's toll on seniors and long-term care mounting, the big question, how do we better protect them?
I think the first change, the most fundamental one, is philosophical. We have to decide that elders matter.
Next, a conversation about changing the system and what better could actually look like.
And later, why these children's classics are being pulled from publication. The controversy behind Dr. Seuss. Ahead.
Welcome back. This pandemic has magnified so many issues in Canadian society, especially when you look closely at who's getting sick. Consider the devastation in long-term care homes. Where seniors go to get help is where they have become ill. And so the question for our era in this country is, how do we serve our seniors with the dignity they are due?
I think that we have come to the place where medical care, like education, ought to be available to every citizen, irrespective of their financial state.
Tommy Douglas, the man known as the father of Medicare in Canada, saw his dream become reality in the 60s, but with a catch that's only now sinking in. Nearly 90% of all COVID-related deaths in Canada are people over the age of 70. The pandemic proving that when it comes to the way we care for seniors, we've been getting it wrong for so long. That's a conclusion of André Picard's new book, Neglected No More. Just how the Globe and Mail's health columnist found the time to write it is another question. I caught up with Picard from Vancouver earlier today to talk about what's wrong and what better looks like. Okay, before we talk about the solutions, let's go to the core of this. When did Canada start screwing this up?
Well, I think like as in many things with healthcare, we're prisoners of our history. We grew out of the penal system, out of the prison system. The Elizabethan Poor Laws of 1601 are the foundation of this. And when people came to Canada, when they immigrated to Canada, they brought this system with them, which said that people who are poor are undeserving. And if they can't feed themselves, we're going to put them in a workhouse and they're going to work for their food. And that has been the case that existed in Canada, that approach, into the 1960s. In my lifetime in Ontario, you could still be in a care home and have to work for your living and go into solitary confinement if you broke the rules. Places still had uniforms for older people who lived in these homes who were destitute. These buildings still look like prisons, let's be honest. And, where else do we put 4 people in a room? We do that in prisons. We don't do it anywhere else in society.
So how did we forget about the elderly?
Well, I think it's a part and parcel of society's ageism. When you become older, you stop being a productive member of society, and then we try and minimize the cost, and we minimize you. We make you a second-class citizen. And I think what's wrong with that equation is we forget that all these elders have worked for 40, 50 years paying taxes. And when you retire, when you need help, that's when you cash in on this insurance policy. And that's what paying our taxes is. It's insurance for being taken care of later. And I think we've broken that social contract, and we've done it in a horrible way. And that's one of the fundamental things we have to fix.
So how many times have we studied this, and how many recommendations from those studies have been implemented?
There's actually 150 studies that have been done on how to reform Medicare since the advent of Medicare in the late 1950s. Life expectancy has increased dramatically since the advent of Medicare. And everyone said, oh, we got to do something. We have to prepare. And we never did. You know, in Canada, we are world champions at writing reports and recommendations, but we're terrible at implementing them. I think we know all the solutions. We just have to start doing these things.
Okay, so what do we have to start to do, though?
Well, I think the first change, the most fundamental one, is philosophical. We have to decide that elders matter, that we want people, no matter how old they are, how many illnesses they have, we want them in the community. We want them to be part of our lives. Then you say, well, why are people going to long-term care homes? They're there because we have terrible home care, because we don't have subsidized housing for seniors, because we don't have simple things like someone to shovel their walk. You know, people end up in long-term care homes at great expense and where they don't want to be for very, very simple reasons, like they can't take out the garbage anymore because they have trouble feeding themselves. All these things can be done in the community. They can be done cheaper, and they can be done more humanely, and they'll make people happier.
So where is the model that we can apply here?
Internationally, the gold standard is Denmark. They did everything I've talked about. They said, institutional care is going to be the last resort, only for the sickest of the sick. Everyone else is going to live in their homes. If they can't live in their homes, we're going to put them in these home-like facilities and take care of them. If you walk down the street in Copenhagen, family home, nursing home, family home, you can't tell the difference. People live in the community. We send care to their homes. We don't make them go off somewhere to get care.
And what about you in your own life?
Well, during the COVID pandemic, I lost my father-in-law, but he didn't die of COVID. He had been tested for COVID the day before he died. He was not well. Turned out he was negative, but he essentially died of loneliness. He was a very active man of 88, playing tennis 3 times a week, playing bridge, going to church every day, a fun-loving, life-loving person. The pandemic came along and his retirement home was locked down. So from between March and July, he just went downhill. He became deconditioned. He became depressed. He lost his vigor. He lost his love for life, all in this very short period. It's a reminder that, yes, COVID was devastating, but the consequences, the unintended consequences, were just as devastating for many people. People locked away were so lonely and isolated. It was particularly hard on people with dementia. They didn't understand, why have my loved ones stopped visiting? Why can I see them outside the window, but they won't come in? Do they hate me? What's wrong? The isolation was so devastating for this population.
And you, Andre, how do you want to grow old?
Well, I don't. Like everyone, I don't want to grow old, of course, but I want to grow old being dignified. I just want to be able to live where I can live to the greatest extent of my abilities, whatever they are. However disabled I am, I want to be part of society. I don't want to burden my children. I don't want my children to have to be giving up their jobs to care for their father because the system that he's paid into his entire life is not taking care of him. So we owe it to ourselves to improve the system, not just for our parents and our grandparents, but for ourselves and for our children.
Andre, thank you for the work you've done for Canadians, because this is a public service, this book of yours. Thank you.
Thank you.
Okay, so we heard him talk about models that work, right? To keep people living in the community for as long as possible, to maintain their independence as long as possible. Are there other examples of those models to follow?
For sure, and there's some in Canada. You know, he's full of admiration for some of the veterans hospitals, like Sunnybrook in Toronto, because he says there the focus is on what the resident needs. What time does a resident want to get up? What time does a resident want to eat? What does the resident want to do that day? It's about their lives, not about a set schedule. And he says, you know, this is what we need to think about how to tweak the little things and adjust the little things, because they make the big difference.
Well, it's a lot to think about.
It is.
For sure. Okay, next, 6 Dr. Seuss books pulled from publication.
I would think of it more in terms of a product recall. You know, we have realized that there are things in these books which are damaging to the consumer.
Some of his stories contain damaging racial stereotypes. So how relevant should Dr. Seuss still be? That's just ahead. Well, from the Lorax to the Grinch Who Stole Christmas, generations of kids have grown up on stories by Dr. Seuss. But now, 30 years after his death, some of his books are being pulled from publication. As Deanna Sumanak-Johnson explains, the problem has to do with the racist imagery they contain.
Do you like green eggs and ham? I do not like them, Sam, I am.
Between those catchy rhymes and whimsical drawings on the pages of some Dr. Seuss books are hurtful racial stereotypes, like this one of a Chinese man in the book, And to Think That I Saw It on Mulberry Street, one of 6 by the late author that will no longer be published.
I think there are going to be those in the United States who cry cancel culture. I would think of it more in terms of a product recall. You know, we have realized that there are things in these books which are damaging to the consumer.
When the Starbelly Sneetches had Frankfurter roast.
Seuss's legacy on race is complex. His books like The Sneetches are seen as parables of equality.
And look, I can hop up and down on the...
But blackface and minstrel imagery is even thought to have affected one of his most famous creations, The Cat in the Hat. And that's enough for the founder of this children's library that celebrates diversity and inclusion to leave all his books out.
Dr. Seuss's political background and also his cultural identity is something that we feel doesn't need to be centered in books that are offered to children to create a more equitable and diverse world.
I don't want to let go.
This children's author agrees with the 6 books no longer being published, but hopes we can continue to have a conversation about them.
Whether it be at a faculty of education or in like a children's literature program, they should be available for us to study, because we pull these things and we also have to avoid like the possibility of sweeping it under the rug like they didn't exist.
The news comes on what's known as Read Across America Day, also Seuss's birthday, often celebrated by U.S. presidents quoting Dr. Seuss rhymes. But in Joe Biden's presidential proclamation about the day, no mention of the author. Deanna Sumanak-Johnson, CBC News, Toronto.
Next on The National, the Queen of Country gets her shot.
Vaccine, 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 vaccine.
So, of course, it included some singing. Our moment is next.
Vaccine, I'm begging of you, please go in my arms.
So that parody of Dolly Parton's famous song, Jolene, went viral on social media last year after the country singer donated $1 million to vaccine research. Well, today, Dolly got a dose of her own medicine. It was her turn to get her shot of the vaccine she helped fund. And tonight, her moment is ours.
I'm very happy that I'm going to get my Moderna shot today. I even changed one of my songs to fit the occasion. It goes, vaccine, 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 vaccine. I'm begging of you, please don't hesitate. Vaccine, 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 vaccine. 'Cause once you're dead, then that's a bit too late. Don't be such a chicken squat. Get out there and get shot. Okay, Dr. Noz, you get in here and give me a shot. I even had a little cutout in my shirt. I matched it over here because I'm sure you can just reach down in there and surely find a muscle somewhere. Well, it didn't take this long to film 9 to 5. Working 9 to 5. What a way to make a living. Think you got it?
I got it.
Okay. That didn't hurt. Just stung a little bit, but hey, I did it. I did it.
And she said, bottom line, that she is old enough and she is smart enough to get it.
Right. Well, and apparently humbled, too, because, so I didn't know this, but apparently she was eligible to get the vaccine earlier than today, like something like a month ago, but that she was really concerned about the optics of having donated all this money and then getting the vaccine. So she just waited. And she said, you know what? I just want to do this right. And
Very Dolly.
That's something, eh? That's The National for this March 2nd. Have a great night.
Good night.